All right. Hello, everyone. Welcome to our monthly Rogue in Motion webinar. Last month, we talked about all the different types of lifestyle factors and wellness activities that have research to support their benefit for people with Parkinson's, such as exercise, nutrition, hydration, sleep, cognitive training, stress reduction, meditation, and mindfulness. If you didn't see that presentation, we'll send out the link for it and you can watch it. I think it's a good overview. And then we will be diving into each of those topics deeper over the upcoming months. Today's presentation is talking about progress, which progress can mean multiple things. That can mean getting better, seeing improvement. That could also mean a progression in symptoms. So language, it's really important how we talk about things. And it's very important to us at Rogue to always have a positive perspective on what's going on. Even when things don't feel like they're going well, that just means that you have a lot of potential to get better. And there are always things that we can do and changes that we can make that can help us feel and do better. So we're going to be talking about some ways to track your symptoms and experiences. My name is Claire McLean. I'm a physical therapist. I'm the owner and founder of Rogue Physical Therapy and Wellness. We have a gym here in Southern California in Orange County, a specialty program for people who have Parkinson's, where we have 40 classes a week, 6 different types of classes at 5 different levels. We really enjoy exercising with people. And we had moved into this new space in 2019, and then COVID hit and we had to, shut down. And so we started doing classes online at that time. And at first it was for our members who were coming in person, but then we realized that we could open up this membership to people who lived anywhere in the country or in the world. And so we opened it up in 2020. So it's been almost 5 years. It'll be 5 years in May that we have been doing the online exercise membership. And reasons for doing this webinar is there's a lot of information that I think is important for people to know. We want to share that information. And we also want to share information about our online exercise membership in case anybody wants to join and exercise with us and access the other types of resources that we have. Our program is not just exercise. Exercise is very important, but so is knowledge. And so is the ability to have access to physical therapists to talk to and ask questions to. And our healthcare system does provide some care, but there also are a lot of barriers and limitations in our healthcare system. And as a physical therapist in the traditional system, you're working with people one-on-one. Insurance often dictates how many visits you get with people or how long you get to work with people. And then when you're not working with them, there isn't really a setup for a person with Parkinson's to be able to contact physical therapists. If you just have questions or what am I doing? How am I doing? Should I be doing this or that? And am I on the right track? There isn't really an opportunity to have access to someone to ask those questions. So that is one of the things that I think is really beneficial with our program in person and online is just that ongoing access to physical therapists to talk about things and ask questions and figure out where you're at. So that's what we are here to do is try to offer as much help and support as possible in many different ways. The different lifestyle activities and wellness activities that we talked about last month are things that we've integrated into our online membership. So yeah, if you have any questions about that at the end, let me know. But for today, we are going to talk specifically about assessments. Let's see, will my slides go forward? So why should we measure? And this is something it's totally up to you if you want to measure or not. You can say, I'm just going to live my life and, incorporate things and I don't want to measure anything. Some people, I know one woman I work with, Terry, when she was first referred to physical therapy, the neurologist said to her, you're going to go to physical therapy so they can measure your decline. And I actually think that that is not what the neurologist intended to say. I think that is how it was interpreted, or maybe she misspoke a little bit or something. But knowing that neurologist, I really don't think that she would have said that. But that could be someone's experience. While Parkinson's is a progressive diagnosis, so if I do any measurement, I'm just going to be measuring my symptoms get worse. Well, that is not my experience. So my experience as a physical therapist working with people with Parkinson's for almost 20 years is that people can get better and stay better over long periods of time. And in fact, we need to measure to know what we need to work on and to know what's happening. Are you getting better? Are you staying the same? Is something getting worse? And if something is getting worse, what are we going to do about it? Is it something that you need to see your neurologist about and optimize your medications? Is it something where you need to adjust your exercise program? There are just endless things that you can do that can be done with regards to medications and medical treatment. But if you're kind of navigating the situation blind, you don't have the ability to know what's going on, how you're actually doing, and if something needs to change, what needs to change. And when you're constantly told, or it's constantly brought up that you have a progressive, incurable neurologic condition, the brain is going to expect to get worse. And then the problem is, if that's what you're expecting to happen, then you're probably not doing anything about it. And then it becomes a self-fulfilling prophecy where you do get worse over time. So it's really important to have, okay, we're muted again. Nope, I'm going to hit the mute there. All right. It's really important to have information to work off of. I also want to be clear that I'm not saying that we're curing Parkinson's with exercise, or that you get better and you experience no symptoms, or that you don't experience changes over time or progression in those symptoms. All of us are experiencing changes in our life as we age related to medical conditions. That is the normal human experience. So I also don't want to sound like I'm saying nothing's going to change or get worse or progress over time. I'm not saying that, but I am saying that we can measure, we can help you be healthy, be strong, independent, flexible, maintain your endurance and stamina, the kinds of things that matter for your life. Those are things that we really can have an influence on. So we want to track things. By tracking these markers, you can identify patterns, measure progress, improvement, or progression in symptoms, make informed decisions about your treatment and lifestyle choices. There's a lot that we can do with this information, and it is important to think of it as information that allows us to make better decisions from. It's not so much about better or worse to me. It's really about information. It is exciting to see people improve over time, though, and maintain that. I have a lot of experience because I have a group of people that I've been working with for over 10 years, and we have been doing assessments for 6 years as part of Rogue. And so we're able to see, screenshots, totally fine to take screenshots. A question came in the chat. So yes, totally fine to take screenshots. We will also, I'm recording this meeting and I will send it out afterwards. I can even send the slides out too. And so that way, if you don't want to take screenshots or take notes, that's okay. You'll get the video recording and you'll get the slides as well if you want to relook at things. So this information is important. Oh yeah. And so what I was saying is I've been working with a group of people for a long period of time. We have been doing assessments over 6 years. I've seen a lot of improvements. I've seen, especially during COVID, people experience worsening of their symptoms with the stress and inactivity. I've seen people get better after that. I've seen someone then get sick and see a decline. And then I've seen them get better again. So, it's important too to understand that just if you see improvement or you see a worsening of symptoms, it doesn't just mean that that's the direction that you're going to head forever. So there's just a lot of ways that this information is really beneficial. And so it's something I thought was important to talk about. There are multiple ways to measure, and you can determine which ones are best for you. The things that we're going to talk about today, and we are not going to talk about every single assessment that exists or every single way to measure. I know for one, there are a lot of apps now that people are using that are giving them good and helpful information. I am not going to be talking a lot about those apps. I don't have as much experience with them yet. I need to get more experience and hear from people and what they're using and how helpful it is. I'm talking about things that I really have a lot of experience with that are easy to access. It doesn't require technology or doesn't require as much technology, depending on which assessment we're talking about. In some cases, you're working with a professional. So we're going to talk about the UPDRS, the Unified Parkinson's Disease Rating Scale. This is something that you would complete with a neurologist. We are going to talk about assessments that you might complete with a physical therapist, occupational therapist, or fitness professional, and then an assessment that you can complete on your own. And completing on your own, the Pro PD, I'm saving this for last because I really think this is one of the best ones. It's capturing your experience of your symptoms, and that really is the most important perspective. But I also would argue that the perspective of your neurologist and a fitness professional or physical therapist that you work with is also really important perspective to have as well. So to talk about the MDS-UPDRS first. So UPDRS stands for Unified Parkinson's Disease Rating Scale. And this is, let's see, we're going to stay muted if you don't mind. This is the MDS means Movement Disorder Society. So the UPDRS has existed for a long time. And at a certain point, number of years ago, the Movement Disorder Society went in and just made some tweaks to make it the best test it possibly could be. This test is used clinically. It is used to help make a diagnosis of Parkinson's. It is also used in research, and it is the primary measure in most cases that is measuring what is happening for people living with Parkinson's when they access a certain treatment. So let's say a medication study randomized, there's a placebo, which is like a sugar pill. It should have no effect. And then there's a new experimental drug. Okay, we're going to measure people on the UPDRS and see what their symptoms are when they start the study. And then we're going to measure their symptoms again, let's say in 6 months after they've been on the medication for a period of time. If we are expecting the medication to treat symptoms, we can look at it in one way. If we're actually hoping or expecting the treatment could be reversing the symptoms of Parkinson's or slowing the progression of Parkinson's, it would be looked at in different ways. So it's quite complex, and I'm not going to get into the weeds too much with that. But basically, if you have gone and seen a neurologist and they've asked you some questions, and then they've told you, okay, tap your fingers together. Now open and close your hands, turn your hands back and forth, tap your heel. There's a number of physical things that they'll have you go through. Most people will have experienced some of that. But the interesting thing with the UPDRS that I see in our area in Orange County, California, is we have one medical system that does the full UPDRS with people maybe once a year. And they actually tell people the score on the test. And then we have another medical system that does not do the full UPDRS, and then people don't have a score. And again, this is something that you may or may not want to score, but I think it's something that would be interesting to ask your neurologist. Are you doing this test? Are you measuring my symptoms from an objective standpoint so that you can track my response to medication or track how things go over time? Let's see. Okay. Seem to be getting a little bit of background noise with some unmuting, but it looks like you muted again. Thank you very much. So the UPDRS has 4 sections: non-motor experiences of daily living, and that's basically questions about your experiences. Motor experiences of daily living, also questions to you and a partner or spouse who's there. Then the part 3 is the motor examination that the neurologist goes through and asks you to do specific movements, and then is grading how you're moving, how big, how fast, how symmetrical you are, how the movements change over time. It's a standardized scoring. And then motor complications is talking about symptoms and side effects that you might be experiencing. So 20 questions are completed by the patient and caregiver. And then there's a training that neurologists go through so that they will be as consistent as possible within themselves from one test to another, or testing different people. And that also amongst different neurologists, if you saw one neurologist and then you switch neurologists, they should be standardized so that they would be scoring you in the same way over time to have good information. So this is what the score sheet looks like. This is the first section that is questions about non-motor symptoms. So do you notice any cognitive changes, hallucinations and psychosis, depressed mood? I have a lot of people who come in and they say, you know, my neurologist just seems like out of nowhere asked me about hallucinations. That's not, you know, I'm recently diagnosed. I've never experienced that. Where's this coming from? So if your neurologist is asking about these things somewhere in the visit, they probably are scoring and doing the UPDRS. They may just be asking to see if you're experiencing any of these symptoms or side effects, but they may actually be scoring. So you could ask, I would ask your neurologist, if I were you. I'd be curious whether or not you want to know what the score is. I would be curious if they are doing the UPDRS and tracking this over time. If you go to a university system, they're a little bit more likely to be doing this, but they still might not. So these are the kinds of things they ask about, and it's specific wording of what they ask, and then there's specific scoring for each of the items. I felt like that was, again, a little too much. I didn't want to get into the weeds too much. This is not something that you would be doing on your own, but I just wanted to show it to you. They ask who's filling out the questionnaire. Is it the patient, their caregiver, or both of them are filling it out? Are they experiencing sleep problems, daytime sleepiness, pain and other sensations, urinary changes, constipation, lightheadedness on standing, fatigue? Then it gets into part 2, which is the motor. So is the person experiencing any changes in their speech, saliva and drooling, chewing and swallowing, eating tasks, dressing? So motor symptoms can affect your daily activities and your life. So it's not just about a tremor. Some people with Parkinson's have a tremor. Some people don't. For people with a tremor, for some people, it does interfere with things they're doing throughout the day. For some people, the tremor isn't too bothersome. But the other symptoms of Parkinson's, rigidity and bradykinesia is slowness of movement. Those symptoms do tend to affect getting dressed. Handwriting is a common symptom where handwriting gets smaller. Doing hobbies and other activities. This could be from physical limitation, or it could be from a change in cognition, or with depression or anxiety. Maybe you're not doing things that you used to do because you feel anxious going out in crowds or being around other people. So they hopefully are asking you about all these things so that they know if those things are a challenge, because if you're having a change in your speech, guess what? You should be referred to speech therapy so that a speech therapist could help you with that. If you are experiencing a change in eating tasks, dressing, hygiene, handwriting, hobbies, and other activities, that's a great opportunity for you to be referred to occupational therapy. If you're noticing a change turning in bed, getting out of bed, walking, or with your balance, or freezing, having difficulty taking a step, that would be a time to be referred to physical therapy. So this information not only should give a score, but it also should be helping the neurologist make recommendations about things and resources that would be helpful to you. They are supposed to keep track of when you come in, are you on or off your medication? So when someone is pretty newly diagnosed, they may have pretty mild symptoms and start taking medication, and it's helpful, and they feel pretty similar throughout the day. For many people over time living with Parkinson's, they will start to experience what's called motor fluctuations, where when medication is really working well in their system, they feel on, they feel good, they can move, do what they want to do. If medication has worn out of the system, it's what's called off. It's like being off your medication. And then they may feel more stiff or more apathetic or have more difficulty with things. So they are supposed to document when you came in, when was the last time you took medication? Do you appear on? Do you appear off? How do you feel? And that's something that should be tracked as well. And everything on here could be different if you are on your medication versus off. How you feel, what you report, how will you move? It could be very different. They're going to be asking for these questions in general over time. How do you feel? But it's hard. If you're feeling bad when they're asking those questions, you're going to be thinking more about the times where you're not feeling so good. If you're feeling good during the questions, it's going to kind of bias your answers that direction a little bit. So even if I'm trying to think of a good example. I can't think of that great of an example. But basically, whether you're on or off your medication, if that is something that you experience, that is likely going to bias your response to these questions. So this is things that they would ask about, and then they would take a score. This part here, part 3, is the motor part. So they are going to assess your speech, your facial expression, rigidity in your neck. They put their hands on your head and they move it around and they see, are those neck muscles stiff? Rigidity in your right upper extremity, your left upper extremity, your right lower extremity, your left lower extremity. Finger tapping, hand movements, pronation, supination, toe tapping, tapping the heel, standing up from a chair, walking. Do they see any freezing of gait where there's hesitation or difficulty taking a step? Postural stability is where they might actually pull you backwards and see, can you take a step and catch your balance, or just hold yourself and keep your balance? How does your posture look? Overall, global spontaneity of movement. Do you have a tremor, a postural tremor in your right or left hand? That's when you're at rest. A kinetic tremors. Do you have a tremor when you go to move? Oh, here we go. Rest tremor, the amplitude, how much rest tremor there is. And constancy of rest. Were dyskinesias present? So these are all the things that they would be observing and scoring, and that would give you a motor score of the motor symptoms that you're experiencing. Then the last part is the fluctuation. So are you experiencing dyskinesias? How much time? What is the functional impact of those dyskinesias? Are you experiencing off time? The goal is for you to be on as much of the time as possible, but have it be a good on, not so on that you're experiencing extra movement. And what is the functional impact of fluctuations if there is off time, the complexity? Does this person have painful off-state dystonia? So these would kind of be a combination of observation and asking you about these things. So the UPDRS is completed with the neurologist. It's not something that you would do on your own. They have training. It's as objective testing as possible. There is some subjective, they're watching. Let's see.
Claire.
Yes.
I'm sorry to interrupt, but I have a doctor appointment and I'm going to have to leave, but I don't see how to leave. I haven't done a Zoom class in a long time and I don't see a leave meeting.
If you tap on the screen, you should see the leave meeting. Tap on it and then see if you see it. I'm going to hit the mute though, Karen. It's totally fine if you need to go. I'm going to keep going with the presentation. So this is a test completed with your neurologist, as objective as possible with observation. Each of the items are rated on a 0 to 4 scale. 0 is normal or no symptoms. 4 is severe. The total number can be helpful over time. We have members pretty frequently who come in and say, I tested a 20 when I first saw my neurologist, and then I started medication, and then I was a 12, and I was feeling good, and then I started exercising, and now I'm an 8. So we hear from people all the time that they see improvements. And again, even if that number is changing or getting a little bit higher over time, that is not something that, you need to freak out about. This is information and knowing, okay, what symptoms are changing over time and in what way? And is it something that's bothersome to me? Is there something that I want to do about it and can do about it? So again, really important to think about it as information and not as a judgment about you. This is information that allows you to know what's going on. Hopefully it matches up with your experience. If you go in and you say, I'm feeling about the same, hopefully you'd come out with a score that's about the same. If you go in saying, I am feeling worse, I had an injury, I haven't been able to exercise, I'm feeling worse right now, then a worse score matches up with your experience. So we want to see information kind of match up with what your experience is and what our testing shows. So I would recommend communicating with your neurologist, ask them if they do this test. Think about if you want to know the score. Again, it's up to you. And if you do want to know the score, let your doctor know. I'm interested. I really want to be proactive with my Parkinson's management. I want to understand and know what's going on. And this information is one of the things that can help me with that. If they have not done the UPDRS, you could ask them and say, I would like to do this maybe once a year, go through and actually have the score. So hopefully it opens up lines of communication with your neurologist and can really give you some good, helpful information. Also, there's times like with medication should help your symptoms be better. So if you came in one time and you tested and you were not taking medication yet, and then you started medication, you might see an improvement. And that improvement is the medication is doing what it's supposed to do. If you then went down on medication for some reason, you might see a worsening of the score. And again, is that your Parkinson's getting worse? We can't really say for sure. What is being measured is symptoms. Unfortunately, we don't have a test that measures in the brain what is happening. So we are using kind of these external symptoms to assess what is going on over time. But Parkinson's could be theoretically getting worse in the brain, but someone could be experiencing an improvement in their motor symptoms with exercise. There was a really interesting study with nuns where there were a whole bunch of nuns that donated their brains to science. And what they saw in those nuns is that they had the pathology of Alzheimer's. So what they saw in their brain should have meant that those nuns experienced cognitive impairment and would have had a significant change in their memory. But these nuns were active, living their lives, participating in society, moving around, doing lots of things. So what that shows us is that the correlation between symptoms and pathology in the brain is not a one-to-one correlation. Sometimes people could have more pathology and less symptoms, or some people could have more symptoms and less pathology, or it could be matching up. But symptoms changing doesn't necessarily mean that your Parkinson's is getting worse. There could be an explanation for change in symptoms, change in medication. I know one gentleman who's experiencing dyskinesia that's bothersome. So you might choose, someone like that might choose to make a change to their medication where they're taking less overall, and then they're not experiencing dyskinesia, which is great, but they may experience a bit more of their motor symptoms then. In that case, we would then try to address that with exercise. So just so you know, it's complicated, basically. So talk to your neurologist about it. Does anyone have any questions about the UPDRS? You can unmute, or you could put a question in the chat. I don't see any questions in the chat about the UPDRS. So I'm going to keep moving, and there will be time for questions at the very end as well. So if you have one about the UPDRS, you can ask then. So we're going to move on to assessments that would be completed with a physical therapist, an occupational therapist, or a fitness professional. And some notes that are important about these assessments that I'm going to be talking about. There are many, many, many different tests and assessments that could be done when you are seeing a physical therapist individually for therapy. If you're going to group classes and they do an assessment as part of that, there are so many different things that can be assessed. And there are different reasons why we might use different ones. It's also important to understand we are not, in this case, assessing symptoms of Parkinson's directly. We are measuring function in most cases. Balance. Are you able to stand on one leg? Parkinson's is part of the picture and what influences your performance on these tests, but many other things in your life are as well. So if you have arthritis, if you've had a joint replacement, if you've been someone who's exercised a lot or hasn't exercised a lot, if you always felt like you were a pretty athletic person, or if you felt like you were more of a musician or you're more of a reader and you didn't feel super athletic. All of us have a history in our life. We have genetic predispositions. We have things that we're exposed to and activity levels. And all of those things together are what is going to present on these assessments that we do. So Parkinson's is part of the picture, but it's not the whole picture. We are assessing function. This relates to your ability to complete the tasks you want and need to be able to do throughout the day. So this is where the UPDRS, especially the motor part, where they're looking at rigidity, tremor, posture, things like that. Those symptoms may relate to your function, or they may be kind of separate. There are some people who have pretty severe symptoms, but are able to do everything they want to be able to do during the day. There are also people who have pretty mild symptoms per the UPDRS, but really feel affected in their daily life. So again, the UPDRS is one helpful thing to measure, but you may find that a measurement of symptoms doesn't feel like it's as meaningful to you in your life and what you are and are not able to do. Hopefully the assessments that therapists do feel very meaningful for what you are able to do during the day. Okay, one more unmute. And mute it again. Okay, thanks. Usually if someone's unmuted, they're right up at the top and it's easy for me to mute them again. All right, the assessments that we do, they are all things that you can improve in. So that's fun. It's fun to measure things that you can get better at. I also think it's important to talk about how I'm a physical therapist, to talk about how a physical therapy evaluation and a wellness assessment are different. So here at Rogue, it is physical therapists teaching group exercise classes. So it's kind of a hybrid. It's not traditional physical therapy through insurance. It's not just an exercise class in the community. It is classes taught by physical therapists. So we're really trying to bridge the gap between physical therapy and community exercise and offer ongoing access to physical therapists. And so when I worked as a physical therapist in a traditional setting, we did physical therapy evaluations. You have to do that if you want insurance to pay for therapy, because when you do an evaluation, you are showing what the problems are, and then you're explaining what you're going to do to improve those problems. So one problem might be a change in balance. A person could come in and say, I've noticed a change in my balance. I feel less steady. I've had a fall and I want to improve on my balance. So within physical therapy, there are specific measurements for us to look at balance and do a deep dive into even different areas of balance and see what's going on. If someone comes in and says, I have a change in my balance, I would need, and for the physical therapy evaluation, I need to measure things that are going to show limitations, because that is why insurance is going to cover therapy. If I test someone and they perform really well on all the tests, then insurance is going to say, this person doesn't need therapy, they're fine. So in physical therapy evaluations, it means that the things that we choose to test, you're likely not going to perform very well on. And that's not very fun. It's not fun to come in and then have all of your weaknesses exposed. But if we test things that you are good with, that you are strong in, again, that doesn't help our case with insurance. So physical therapy evaluation is honed in on a specific problem to identify what the problem is so that we can work on it. A wellness assessment is now what we do here at Rogue, because we are not doing individual physical therapy, but we still need to measure what's going on and know if the classes and exercise that we're doing is having a positive impact like we are intending for it to, if we need to make any changes. So a wellness assessment, we do some of the same tests, but what we're doing is a broader range. So instead of just honing in on balance, we're looking at balance, but we're also looking at strength and endurance and flexibility and mobility. We're trying to look and do kind of screens looking at a lot of different areas to see where someone's at. And then if we do identify a challenge with balance, that might be a time where we're making a referral to physical therapy. Or if we identify a challenge with fine motor dexterity, we might be making a referral to occupational therapy. If someone really has limited endurance, we know that's something we need to work on. Some people have limited endurance, but good strength. Or some people have good strength, are weak, but have good endurance. So different people present with all different pictures. And by doing all these different assessments, we see where they're at. And we also want to test things actually that people perform well on. We are hoping that of the wellness assessment that we do in all the different areas that we test, that we see areas of strength and areas of weakness. So we can highlight and say, hey, you're really good in this area. This area is where there's some room for improvement, because that is kind of mentally a better experience to have some strengths identified along with weaknesses identified to work on. So I'm going to show you the things in our assessment. So these are the things that over the years we have chosen to focus on and look at as screeners. This is not every single assessment that can be done. There's a lot more that can be done in therapies, but this is the one that we feel like is relatively efficient to get through, gives us a lot of information, allows us to make recommendations with individual therapies, with an exercise program, and also to track changes over time. Also, our assessments that we do in as many cases as possible, our goal is to pick tests that have age norms. So that means a research study has been done where they took a population of people, maybe between 50 and 90. They all tested them. And then they said, okay, this is what's average for someone in their 50s. So this is average. This is what's average for someone in their 60s, 70s, 80s, because that's what we're comparing to is age norms. And if you have Parkinson's, maybe you're not going to test an age norm in all the areas. That's okay. That's realistic. But maybe you are going to test at or above age norms. And then that's a confidence booster. And it also just gives us some barometer and way to assess. You know, it's not just a random number that we're looking at. In some cases, there are tests that have been identified. There's a cutoff that is related to fall risk. So if someone takes a certain amount of time to do something, that might correlate with an increased risk of falls. Or for some tests, if like how long you're able to balance on each leg, that is correlated with a risk of having falls. So the main thing that we're focused on is looking at age norms. The first time we do the assessment, that's the only thing we have to compare to is the age norms. If we do that assessment subsequent times, like here, we do the assessment every 6 months for our members. And then what was I going to say? I just lost my train of thought. Once we do a subsequent assessment, we then are able to compare to the age norms, and we're also able to compare that person to themselves 6 months ago. So we can say, okay, you're holding steady. Things are the same as they were 6 months ago, or you've improved, or this has gotten a little bit worse. And now we want to do something about that. It allows us to be proactive and catch things early. So the areas that we look at the 9-hole peg test, which is looking at fine motor dexterity. We look at grip strength with a dynamometer that you're squeezing, and it gives us an objective number, how many kilograms of strength you have in your hand. We look at processing speed and set shifting with a test called Trail A and Trail B. So this is looking at cognition. We do the 60-second chair stand test, which is standing up and sitting down from a chair as many times as you can in 60 seconds. This is a measure of functional leg strength. If you've been to physical therapy or even at your doctor's office, they might have tested your strength and said, lift your knee up in there. Don't let me push it down. Okay, bend your knee. Don't let me straighten it, vice versa. The thing is, our leg muscles are very strong, and the ability of someone to push your leg down or push it, if we are able to move your leg, you're already pretty weak. And it's not really a functional way of measuring, whereas standing up from the chair is a functional measure of strength in your legs. We do the 360-degree turn as a screen for freezing. Freezing is the symptom where your foot feels like it's stuck to the floor and it's difficult to take a step. And the 360-degree turn, turning around in place, is one of the best ways to capture that. We test single leg balance. We time it. We do a test called timed up and go. And we also do a dual task where you're doing something cognitive at the same time. We measure walking speed 3 ways: your comfortable walking speed, your fast walking speed, and then we ask you to walk with as big of steps as you can. And we are measuring the time it takes you to cover 10 meters. And then we can calculate your speed. And then we also count how many steps it takes you to cover that distance. For many people early on, their walking speed might be pretty normal, but their steps are getting a little bit shorter. So we are both looking at quantitative measurements and also some qualitative measurements as well. The 4-square step test is looking at stepping in different directions around like a plus sign that's down on the ground. So you step forward, sideways, backwards, sideways, and back around. And we time that. We do a floor transfer where you get all the way down to the ground on your stomach and back up into standing. And then we do the sit to rise test where you start in standing, you sit down on the ground, and you stand back up using the fewest number of limbs possible. Those are both looking at mobility in different ways. And then we do the 6-minute walk test for endurance. So we run through, and with these tests are easiest to do in person with a physical or occupational therapist or fitness professional. They can be done online. We do online assessments for some of our members. In that case, we have written instructions, and there are some things that we ask you to do on your own ahead of time and bring us that information. Because like the 6-minute walk test, usually you have to go outside or go somewhere where you have more distance that you can walk. So it doesn't really work for us to do it online together. So there are a few things we ask you to do ahead of time and bring us the data and information. And then there are some of the items that we do together on Zoom. And then we go through and talk about the results. And then also there are quite a few of these things that you could do on your own at home as well. You would need a bit of coaching just to get set up. You might need a little bit of equipment for things. It would be best for timing if someone else timed you, a spouse, a friend, an adult kid, somebody else to time you so you're not timing yourself, because that is a distraction that would affect the speed that you did something. But these are things that you could do on your own as well if you wanted to measure some of these things and measure them over time. So lots of options. I just wanted to show you what a write-up looks like. So this is a recent write-up for an assessment I did in February for a woman who's 70 and who has had Parkinson's for close to 20 years. We record what time we're doing the assessment, the last time medications were taken. For that same, are we testing on, off, or is it even, for some people, they might feel kind of in between. We take blood pressure and heart rate. And so then we make a note if they felt on and we observed them being on, off, or in between. Question that came through in the chat: what distance do you do the walking test over? Do you do the 6-minute walk test on the treadmill? So great question. So the distance for the 6-minute walk test ideally is you have a 100-foot, basically, a cone and a cone that are 100 feet away, and you walk back and forth, cone to cone, as many times as you can in 6 minutes. We do not do the test on a treadmill. The tricky thing about a treadmill is you're setting the speed. So it's a little less measuring the person. I mean, you could say, okay, walk whatever speed on the treadmill feels comfortable, but most people feel like a treadmill's going a little bit faster than what they would be going if they were on their own. So it would basically be a different way of doing the test. And I don't know of a standardized way to do that. So I have not done it with a treadmill. You could theoretically do that though. And you basically would want to set up kind of a standard weight and do it the same subsequent times. And then the sit to rise test is 1 repetition. So you start in standing. The goal is to get down into sitting and back up to standing using the fewest number of limbs possible. So your hands and your knees count as limbs. The feet do not count. Your feet have to be on the ground. We're not asking anyone to levitate. So you get down, and maybe some people are able to sit down and stand back up without touching their hands or knees. Some people need 1 limb. Some people need 2. Some people need 3. Some people need 4. Some people are not able to get down on the ground. So you score, the score is a number, and it's the number of limbs needed for getting down and back up. So great questions. So for this lady, when we did her assessment, so we did it in February, and we had done it in September previously. So what we have on this assessment form that we write up for people is we have the data for their most recent assessment on the left, for their previous assessment in the middle, and we have the age norms on the right side. We then put a little check mark if they are at age norm or better, if they have maintained or improved since the last assessment, and if there's room for improvement. So in this case, she tested very similar, both on right and left with the 9-hole peg test, looking at fine motor. She tested very similar to 6 months ago, but she is a little bit slower than age norms, 4 seconds slower on the right and only about 2 seconds slower on the left side. So she maintained, but there also is room for improvement. So there may be multiple check marks depending on the test. Then for grip strength, Zoom's giving me a little try on share. Okay, for grip strength, she tested at 28 on the right, 26 on the left. Last time was 27 and 27. So, teeny bit stronger on the right, teeny bit less on the left. Basically, that's the same. And in this case, age norm is 19.6 to 33. So she is good. She is kind of middle to upper end of that age norm range. And then has maintained. So that's great. Trail making is you're drawing a line, connecting dots in numerical order. And trail A is numbers only. Trail B is numbers and letters. And you have to go back and forth. 1, A, 2, B, 3, C. That cognitively is very challenging to keep track of both going back and forth. So she got about a second faster on trail A, which was the numbers only. She, did it like 15 seconds faster for trail B. That is awesome. That is showing that her cognition is improving over time. And we actually have a few assessments for her. We don't write them all down because it would be too much text, but she was, I think, for 3 times right around 80 seconds and then 64. So she was consistent and then got better. So that was very cool to see. So she is at age norm or better. She's better than average, and she has maintained or improved since last time. Very cool to see. Then functional leg strength. She did 12 repetitions in 60 or 30 seconds and then 25 in 60 seconds compared to last time was 29. So it was a little bit less than last time. Age norm is 25 to 36 though. So she is still within age norms, but she did not maintain. So we're working on that. Turning. Our goal is that people are able to turn 360 degrees in 3.3 seconds or less and in 6.5 steps or less. So she is right around our target, and we want it to be just a little bit faster on the left, but the correct number of steps and pretty similar to last time. Balancing, big improvement. She was able to balance 20 seconds on the right, 20 seconds on the left. Last time was 9 and 4, and age norm is 11.3. So she's at age norms and she's better than last time. Very cool to see. She's been working really hard. Walking balance. Her time was a little bit slower here on both of these. So we want to work on that again. So we see some things that are better, some things that are worse, things that give us goals and structure that we want to work on. Her walking velocity was a little bit slower than last time, and it is slower than age norm. So we are working on that. She is someone who experiences freezing. So we basically have to slow her down a little bit because that prevents her from freezing. If she's taking slower, bigger steps, if she tries to speed up too much, that increases her freezing. So in this case, I would rather her walk a little bit slower if it means she's not freezing. But our goal over time is for her to be able to walk faster and still not freeze. Agility with the 4-square step test. She did a little bit faster in both conditions, single task and dual task. getting down to the floor and back up. This is standing, getting down on your stomach and back up. She did in right about the same amount of time, very fast. She was able to get down with one limb and up with two limbs for support. We did not test the 6-minute walk test this time because it was raining. And last time because she has freezing, we did 2 conditions. For someone with freezing, if they're going back and forth and they're having to turn, what we see sometimes is that people have freezing on the turn and then they're not able to walk as far. So we did with turns walk, and she was able to walk 1,290 feet, which is 83% of age norms. And then we did one walk where we just walked away from our front door and around the block, and we didn't make a turn. And I measured that distance. She was able to walk another 100 feet, which puts her at 90% of age norms. So basically her freezing reduced her walking distance by 7%. So as you can see, this gives us a lot of information to work with, and it's not all good. It's not bad. It is, in my opinion, is good information that allows us to do things about it. So we write up a summary. She did very well in the assessment. She tested at or above age norms in 9 categories. For the areas where there's room for improvement, she was very close on quite a few of them. She's doing great and has improved a lot since the first time we did the assessment. She is still working to optimize medication with her neurologist. We discovered some new things about her on with medication, actually seemed to have more freezing than off. So, working through what that means. We did some new balance training that she's going to incorporate, and goals to get her to age norms with the fine motor dexterity, turning speed, dual task walking balance, and walking velocity. For the 6-minute walk test, we did that on 2 different days. So the question, did we do those back to back, in which case someone could be fatigued from one? So yeah, in that case, we did those on 2 separate days. All right. Any questions about these assessments that you could do with a physical therapist or another healthcare professional? All right, I'm going to move on because timing wise, we got about 12 minutes and I want to talk about the Pro PD. So the Pro PD is a way that you can do an assessment at home and measure your experience of Parkinson's without needing to work with anyone else. The Pro PD was created because other scales do not permit this type of analysis. It's patient-centered, continuous measure of disease severity that is stratifiable by symptom, correlates with quality of life, and existing scales for PD severity. Lower scores are better. This test was developed by Dr. Lori Mishley, who is a naturopathic doctor in the Seattle area. They surveyed over 1,000 individuals with Parkinson's, asked them to describe their symptoms. The most common symptoms were fatigue, impaired handwriting, loss of smell, memory impairment, and muscle pain. And this looks different probably than what the UPDRS measured. It did talk about handwriting and asked about cognition, a little bit about muscle pain, but it isn't necessarily the main focus. And also our assessment that we just talked about gives us a lot of really good information, but we didn't ask about a sense of smell, fatigue. We didn't ask about muscle pain. We often hear about it. If someone experiences muscle pain, they'll tell us. So each of these dots is a person with Parkinson's. On the bottom, this is how long someone has been living with Parkinson's, the year since they were diagnosed. And this is the score here. 0 is the best score. That basically means 0 symptoms or they're not bothersome at all. So the trend is that the longer that someone has had Parkinson's, the more symptoms they will experience. That is a general trend. But there are people who've had Parkinson's almost 25 years whose symptoms are better than average and their quality of life is good and excellent. There are also people who have been diagnosed a very short amount of time and have a very poor quality of life and are experiencing a high burden of symptoms. So this is the kind of thing that is really important for your healthcare professionals to see, because your experience of your symptoms is not the same as their observation of your symptoms. And this Pro PD is a really good tool to communicate that. So basically our goal is to help more and more people be the dots out here that have had Parkinson's a long time and have a good quality of life. So we want to intervene as early as possible, make as many changes as possible to help you be one of these really healthy people. So what does your score mean? Dr. Mishley is one of the people who really believes that disease modification is possible, that it is possible for people to get better, to slow the progression of their Parkinson's, to see a reversal in some symptoms, but it needs to be measured. So when when you fill this out, you can get a total score. They also can show you what of your symptoms are the most bothersome to you. So there's a lot of good information that you can gather from filling this out. This is a study they did that showed that this self-rating scale correlated with other existing scales of disease severity. They compared it to the Parkinson's disease questionnaire 39, PDQ 39, which is a quality of life questionnaire, the patient reported outcome measurement, and I think even they compared it to the UPDRS as well. So it correlated well, which is important. Some statistics. So the score at diagnosis tends to be just above 500, and the average change per year is an increase in 38 points. So this is where you can see this is average for people when they're first diagnosed, right around 500. And then this blue line is average progression over time, which is a change in 38 points on average. So if you can see an improvement or change less than that, you would be doing better than average. So how to use the ProPD as an individual. It's something that you can do to self-assess your experience of symptoms. It might help you identify things that are going well or not so well, or that you had a hard time figuring out or putting words to or explaining to someone. You could figure out what could be better, which symptoms are most bothersome to you, and then figure out, is this something I need to talk to my neurologist about? Is this something that I need to work with a nutritionist on? Is this something that has to do with exercise? And then, do you need anyone's help? Reassess after you make changes. So you could say, I'm going to make a significant change to my diet for a month, and then I'm going to reassess my ProPD a month later, or you can give it 6 months. You can fill it out as often as you want to, as often as is helpful. At a minimum, I would say once a year would be a good idea to do to give you some information. And this can be a really helpful tool to communicate with your spouse what you're experiencing, your neurologist, other healthcare professionals. It might even be good for your spouse to fill it out and for you to see their perspective of symptoms, because usually there's going to be a difference of the experience of the person living with it and a person who's observing it or seeing it from the outside. So you can do this both with a website. Where did I put? Okay. propd.org is a website that you can go to on your computer to fill it out. This is just an example of a few people who filled it out at a time point here. Then they filled it out, got better, got a little bit worse, but still in the excellent zone. And it kind of went back up from 2018 to 2020. So over the course of 2 years, it got better. And then it was about the same. This person experienced an increase in symptoms, but again, it's not linear. There were some ups and downs over time. This person got significantly better. Symptoms have crept up a bit, but they're still doing better here than they were when they first filled it out. This person experienced a significant worsening of their symptoms, then got better over time. So all different types of experiences are possible. So you can fill it out on a website. There also is an app called Parkinson Symptom Tracking that you can download. It is free. You just have to make an account. I did a quick screenshot video here so that you could see what it looks like. So you have to create an account if you don't already have one and log in so it's secure. You would fill out this information, and then I'm going to pause. So John Smith, to time frame. So the more you fill it out, the more information it would show you. It tells you what your total score is. So seeing it as a number or seeing it graph out. And then this is each of the items that it asks about 35 different things. It's basically the way you score it is you slide this little dot. With regards to slowness, do you move with ease or do you have severe slowness? So you move that to the point that is appropriate for you. What do you experience in terms of constipation? How is your walking? Do you have freezing of gait? So it goes through and asks about different areas, nausea, daytime sleepiness, and then it gives you a total value, and it looks like here, I think it's ranking the most bothersome things. So medication side effects, drooling, handwriting, walking, stooped posture, and sexual dysfunction were the most bothersome for this person. You can click to see charts. So here that is laid out chart-wise. And again, this is something that you can show to your doctor. It's very helpful to let them know what you're experiencing. And I would say it's very helpful for people to see this information themselves as well. It's different than just trying to verbally describe what your experience is. Really putting it in words, on a graph, on a table is very helpful. So I'm a big fan of the Pro-PD. So, and then how is the Pro-PD used for us to learn about the population of people living with Parkinson's? So Dr. Mishley is doing a study called the MVP, Modifiable Variables in Parkinson's. I highly recommend you consider participating. It's a survey where you fill out every 6 months, very detailed information about how much you're exercising, what's your weight, what's your quality of life, what you're eating, how well you're sleeping, what medications you're taking, if you're taking any supplements. It's very comprehensive. It asks about a lot of different things. And then people fill out the Pro-PD. And so they're able to say, okay, people who are exercising 7 days a week, their score on average is 300 points better than people who are not exercising. And if we know that 38 points is the average per year, that means this is like 9 years worth of difference of progression of symptoms. So I love this data. It's very helpful because when it comes to research with exercise, it's hard to say, okay, what's the best exercise and then what frequency is important? What if someone exercises 1 time a week, 2 times a week, 3 times a week? There isn't really many studies that's able to compare frequency of exercise. So Dr. Mishley gives us some of the best data. People start to experience improvement when they exercise a minimum of 3 days a week, and each additional day is additionally beneficial. So 3 days a week is a minimum, but the difference between 3 and 7 is over 100 points. So that's like 3 years of difference. So let's increase that frequency. The types of exercise. So running was the first one. That is a high intensity exercise, and that's what the research supports as well. Seeing the change in symptoms for someone who's not overweight versus overweight. There's a difference, but there's kind of a typical trend. There is information about quality of life, and I'm running out of time, so I'm not going to go through all of this in a lot of detail, but this information exists. If you participate in the study, you get data about it. Food choices, dietary behaviors and how they are correlated with Parkinson's progression, what foods are correlated with people doing better, what foods are correlated with people doing worse than average, so you can make some good choices about what you're eating. With the Pro-PD, I highly recommend you utilize this. If you utilize the app, it will save the data in the system. If you go onto the website, it will ask you if you want to participate in research, whatever you feel comfortable with, go ahead and do that. If you want to communicate with your neurologist, if you're filling it out on a computer, I highly recommend before you hit submit that you save as a PDF or print the page so that you have not just the total number, but you have, which items were the most bothersome to you. So you can take that, you can look at it yourself, make notes, you could show it to a spouse, you could show it to your doctor, you could keep it and compare it to the next time you fill it out. So it'll give you better information than just that total score. And then if you fill it out over time, is your score worse, same, or better than average for how long you've had Parkinson's, or for you comparing over time? Go through and circle the items you want to improve or address with your neurologist. Do you have any ideas or questions about those things? Who do you want to talk to you about it? What can you do about it? We want you to have as much control over the situation as possible. And is there anyone else on your team that could help? So these are some of the items. Again, I won't go through that too much. It'll ask you to put in your age, how long you've had Parkinson's, gender. Do you want to use this in research? It'll give you a cumulative score. And do you want to be contacted for other things? So that is all up to you. What we're trying to do by giving people this data is we want to see more people doing well here. We want to see more people doing well out here. We want to change the trajectory so that there is less progression experienced by people over time. And that means, each person doing things differently, and also as a population, us doing things differently. So we want to change this. So maybe we can get that line to be more similar to the changes that are experienced with typical aging. You can't manage what you don't measure. So I know a lot of people don't love doing these assessments or don't like seeing this data and are concerned if something's worse, but really having good information is what's going to allow you to make good choices and do do things differently. So I highly recommend that you figure out some way that you are willing to have this data and information, and get started, and, let me know how it goes. So if you are not a member of Rogue currently and you would like more information, coaching, exercise with us, access to experts, you can consider joining us at rogueinmotion.com. You can use the code free month for 100% off the first month of your membership. There's a 7-day free trial, so you get to try it out and make sure it's a good fit for you. You can cancel anytime if you're an online member. We're here and we are really wanting and hoping and trying to help you all as much as possible. So let me know if you have any questions. Does anybody, I'm going to see if there anything else came in the chat. What frequency do you recommend the Pro PD is filled out? Once a month or a week? Doesn't matter if you do it at the same time, each time, or whether it's on and off period. So it really depends on the person. I don't recommend a high frequency. In general, I would say one time a year. If you felt like I want information a little bit more often, you could do it every 6 months or quarterly, or if you make a change, you could do it more frequently, but I don't think it's something you need to be doing a lot. I think it's doing it once and then making, decisions. If you do it during off versus on, I mean, I would document and say, I was off when I filled this out, or I was on. I don't think it actually asks you about that on the questionnaire, but I would make a note of that myself. And when it's asking you about things, again, it's asking you on average, like for the past week, what did you experience? So ideally, you are taking into consideration off and on times and kind of an average or in general. But I just think if you're feeling off at the time, that's going to influence how you score things versus if you're feeling on. So, I basically recommend doing both, but just making a note as which one it is so you can see the difference. And yes, we got Pro PD is a great tool. Very, very much agree. And PJ, looks like you're trying to get off mute. I'm going to go ahead and stop my share and stop the recording. For anyone watching the recording, if you have any questions, you can email me at claire@roguept.com or give us a call at 714-276-3992. And I will stop the recording.